Welcome back to the Finding Financial Fitness Show. I'm your host, Nino Gonzalez, joined by my co-host again, Pei Chen, and a very special guest, Dr. Dustin Moore. Dustin, welcome to the show.
Hi, guys. Thanks a million for having me on. Good to be here with you.
Yeah, so just wanted to kind of give a little bit of background of who Dustin is, and I'm still getting used to the doctor name because I've known Dustin for 7, 8 years now, and he finished his doctorate. How long ago was it now, Dustin?
It was a year ago
Yeah,
last summer.
crazy. I'm still not used to it, so just calling him
I'm
Dr. Moore is
I'm
weird.
not I'm never gonna get used to saying Dr. Moore either. And I always like have that gap where I tell people like, whoa, 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 Dr. Moore is my father. But no, my father is Mr. Moore, so I can't say that. So you can stick to Dustin and keep it easy.
Yeah,
Yeah,
before
so
we
so
started recording, I was like, Dr. Moore, are you sure? Because this could be an imposter.
I love it.
Yeah,
No, like I mentioned, I've known you for what 7, 8 years now, and
yeah,
we
that's
talked
wild to
on
think about.
on one of our shows, one of our recent shows, we discussed the importance of having mentors and people kind of in your life you that are paving the path for you and that you can kind of look up to and that will be a good role model for you. And Dustin was that person for me in the nutrition world as I became a dietitian. If y'all don't know, you have to go through a year of dietetic rotations, and Dustin was my dietetic coordinator. And I felt like he was always looking out for me, although I was kind of an oddball. I felt like he would really take a kind to me and want me to succeed and allow me to thrive. And similar to how I shared my stories with Pei on this podcast of how she was for me in the financial world, I personally I consider myself a little bit of an odd character. So finding people that can understand me and allow me to thrive, I think is such a great opportunity. And Dustin was that for me. So wanted to have him on just to talk about his background, his doctorate in public health. So he himself is a clinical dietitian as well. And for those of you that don't know, the dietetics field is, what is it, Dustin? 94 or 97% women?
It's almost entirely women. Yeah, it's like around 96% women.
Yeah, so it's a predominantly female field, which is interesting as men coming into it and being involved in it. There's different takes that maybe we kind of see it from a different perspective, and Dustin's just had a lot of experience just from a clinical standpoint, but as a teacher, as an educator, and so I'm very excited to have him on. And also, I mean, he's probably the only guest that we've had on that has been on Good Morning America. So you can't.
Not related to dietetics, though. Absolutely
Nah,
nothing related to dietetics.
can you tell? Okay, I love this story, Dustin. Can we open up? Can you
Okay.
tell us that story about why you
Yeah,
were on Good Morning America?
yeah, absolutely. And it's kind of funny that you start off with that because I actually haven't told this story in a very long time. So, years ago, this would have been around 5 years ago, so about 2018 or something like that. My wife and I we've never been able to have children on our own through conventional, means and whatnot. And we decided to shoot for adoption. And so we got a certification, we got adoption ready in California, and we eventually came across a wonderful birth mom who matched with us, who placed her baby with us. We adopted our daughter, Mackenzie, through that adoption channel. The story is that when we adopted our daughter, we flew out to Colorado where she was born. And then we had to wait out there for a couple of days. I think it was about a week actually that we had to wait before you have this clearance to basically have the two states acknowledge, okay, you are the legal parents of this child. You can travel with them and return home. So we were staying with these very sweet people. And then when we got clearance, we booked a flight on Southwest and headed back out west to California. So on the flight, while we were on there, we were super nervous about traveling because Mackenzie was like a week old. She would have been a week old at that point, and we're brand new parents. We've been trying to have kids for a very long time at that point. So just happy, just grateful, but very nervous about the whole flight. And while we were on the flight, a turn of events came about where the flight attendant named Jenny, she found out that we had just adopted our daughter because she just asked very casually, very sweetly, like, your daughter's beautiful. You don't mind if I ask how come you're flying with such a small newborn? And we explained because we just adopted her, we're going home. And so a little while later, another flight attendant came up to us, kneeled on the aisle next to us, and said, "Hey, heard something kind of cool. So this is your daughter?" And we said, "Yeah." He goes, "So you just adopted her?" And just like confirmed a bunch of information and then introduced himself. His name was Bobby. And then he just kind of left it at that and he walked away. And both my wife and I like looked at each other like, what was that all about? And we are like, just went about the flight. And then probably not even 2 minutes later, we heard over the intercom Bobby, the flight attendant, say, "Hey folks, we've got a very special announcement that we want to share with you. We've got a very special guest on board this flight, Mackenzie Moore. She's 8 days old and she's making her way home to California with her parents, Dustin and Karen, who just adopted her." And the entire cabin started cheering, like applauding and cheering when that happened. And my wife and I were just kind of shocked and just sat back there as he continued on saying, "Let's wish them well and let's pass out napkins. We're going to pass out napkins and pens, and everybody, if you want to just, share with them more as your best parenting advice or your best wishes for them, please go ahead and do so. And we'll bundle it, collect it, and give it to them, present it to them." So they did. So they kind of called it this impromptu baby shower on Southwest Flight. It was incredibly sweet. But what happened after that is I was kind of pissed because of something that happened at work. And instead of trying to be reactive about it, I wanted to share something a little uplifting. And so it was on Twitter. It was called Twitter. That was back when they called it Twitter, which I still refuse to call it X. Sorry. It was back when it was called Twitter. I sent out a thread on Twitter and sent it to a couple of friends about the story of Kenzie's adoption in that flight home because I'd never shared it. I went to bed, I hit send, went to bed, and then I woke up the next morning and my phone had hundreds of notifications on it, hundreds of messages from reporters and journalists, and they wanted to know about it. And then a little while later, somebody from the Washington Post, whose name I can't remember the reporter's name, but she basically does like feel good stories. She did an official story that was published, and then that started circulating again all over social media, and eventually it made its way to like Good Morning America, Kelly Clarkson, who all had us on to do like a short piece and a bit and share the story, which everybody just loved hearing about, of the kindness of strangers who had just done this very selfless thing for us, this very kind and encouraging thing for us with our daughter, our first daughter that we adopted. So sorry, a little bit long winded, but that's A to Z, from infertility to Kelly Clarkson, how those are connected to each other.
I love it, man. No, it's such a good story because if it should happen to anybody, it's you, because I think just you're such a humble and such a down to earth guy that I know how much your family means to you, and so that's great. So into kind of the nitty gritty of it all. So you talk to me about your experience as a dietitian, your years both as a dietitian working in the field and then as a teacher of dietetics and nutrition, and then transitioning into why you decided to get your PhD in public health and pursue your education further.
So where should I begin then? Should I start off with like career? Should I start off with telling about you, like career prospects or how that ran in, or should I just like kind of where do you want me to begin with that?
You're the guest, Dustin. I want you to talk about yourself. Tell me about you and your career and how that started.
So most of my career has been in the field of education and research. And I guess you could also tack on like counseling as well. So my career started, I got into dietetics kind of as an offshoot of wanting to do medicine. I had wanted to become a doctor. And then as I learned more about becoming a doctor, I realized this is not nearly as sexy as the show House portrayed it to be. Do you guys remember the show House?
Yes.
I think Hugh Lowry was the star of it. We were like, my wife and I were big watching that when it first came out. And when I learned more about it, I thought, cool, but it doesn't feel right. And eventually that just kind of segued to dietetics because I had also always had a love for food, always had an appreciation for food. And I liked more so the prospect about prevention, about primary prevention rather than secondary, tertiary care, which is usually where doctors come in after something has already gone wrong or, illness has occurred. And so long and short of the story is I was at BYU. I finished my bachelor's in dietetics. I did my practicum work and my master's degree at Cal State Long Beach, where both my wife and I were native to and wanted to return to. So once we moved back down here and I finished, looking around at jobs and everything that there was, I started off with kind of a job as a lecturer at Cal State Long Beach. The story on that one was just how I had been job hunting and I really wasn't sure where to go. I was very good in the clinical field. I'd done very well and I kind of thought that's where I would go. So I looked around, but I didn't really find anything that felt like it stuck well. And as a matter of fact, I did in fact get a job with an agency, which I will not name on this because just to be tactful. I got a job with an agency where I had an opportunity to work as both clinician and a food service manager, which I thought was cool because I loved both of those fields. But the pretenses under which I were hired were very different when I actually showed up in person to start learning about, the job and what was expected of me and what I was going to do. And it basically just turned into a fallout. I had very little respect for the person who hired me. He kept changing up the requirements, and I was thoroughly pissed by the end of my first day. So at the end of my first day, I drove home, called on my wife. I was just telling her about just what had happened and how it completely had upended itself from what it was supposed to be. And my wife, being the wise woman she was, she goes, we need tacos. So we went out and we got like tacos and like discussed, prospects and what to do. And we ultimately decided that I was going to resign. So I wrote a letter of resignation one day. I was employed with that company for one day and left. And so under this, I was just kind of beaten down by life circumstances and just feeling very humbled because of what had happened. And so about a week later, I was in the office of the chair of our department at Cal State Long Beach, whose name is Wendy Reibold, a name I can share with respect. And Wendy asked me in a roundabout way, what are your intentions after you finish your master's degree, which I was about to finish up at that time. And I kind of flippantly, kind of sarcastically, but also kind of seriously said, why don't you give me a job? Why don't you give me something to do? And she said, well, that's kind of the reason why I invited you in. I wanted to talk to you because we have a need for a full-time lecturer. And I had had a little experience as a TA in the master's program. I had subbed for a couple classes. I had taught an intro nutrition course and I loved it. So that kind of set the groundwork for it. Totally didn't expect to get into it. Totally did not expect to go the route of working in education. But once I was in it, I loved it. Absolutely dug it. And that was kind of where my career started. And then that kind of launched into a couple of other opportunities as time progressed. I started working as an outpatient counselor in Long Beach, specializing in bariatric disorders. So I got to be in the clinical field and doing something that I really did like. I liked sitting with patients. I liked talking to patients more so than, Nino knows this, like as a clinician RD, for a standard inpatient hospital, your education opportunities are pretty limited. Like a discharge, you talk to a person for maybe 10 or 15 minutes and then it's oops, Bob's your uncle out the door. But in outpatient care, you get a lot more time with people and you get to set goals and do follow-ups with them. So this is all leading up to, this is where I met Nino. I was there for a few years and finished my master's degree and was just kind of working along. And then a job came up to coordinate our ISPE program. So ISPEs are dietetic internships, but they're unique in the sense that students are only allowed to come to ISPEs if they've not matched through the first primary channel that most dietetic students do. And number two is you have flexibility to do rotations as you see fit if you want to. And my first year, that was the first year I had as coordinator with Nino's cohort. There was 12 of them in that first year. And that was where the two of us finally made contact and first met one another. So, this is where I'll kind of segue this here and I'll just talk about Nino and I'll boost him up on the podcast for you for a second here. There's a strong principle that I believe in when it comes to like governance and public policy and whatnot, which is teach good principles and then get out of the way. Teach good principle to people, teach good principles, set a good orientation, and then just get out of the way and let people do something good with it. And Nino epitomized that because within that cohort, Nino had, this isn't I'm not sure how much of this I should disclose because this is kind of your story to share too, Nino, but you had come to us and it shocked me that you had not matched to an internship. But if I remember correctly, the reason why was because like you forgot to call or reserve your appointment that you've been given. Is that right?
Yeah, it was a technicality, basically. Yeah.
It was a technicality that Nino ended up coming to us, but all the better for me on that respect for getting him a chance to meet him and know him because in that cohort, like it was a solid group of people that we had. I was nervous because it was my first group that I was in charge of. trying not to show that, like not making apologies, not saying things like, "Oh, this is my first year, everybody, so let's hope this goes well." I'm like, no, dadgummit, no, we're leading ahead, we're fixing bayonets, and we are charging. But Nino was solid because of the fact that, I mean, he had a work ethic unlike anybody else, which I think now that, I mean, at this point, you know this, I think you know this, the ISB is, it's been closed. We've finished it. We've started a new grad program, and I'm pretty sure that you hold the record for the hardest work ethic of anybody who
That's it. That's all I wanted you on here to confirm. We're done. Podcast over.
I mean, it was 6 months, I think.
Yeah.
6 or 7 months. I mean, the program is meant to be about a year long of how long you go for it. And Nino was like continually coming to me and saying, "Hey, I got this opportunity where I could do this here. I got to wake up at 4 a.m, but I could do it and I could get the hours done. Like, could I do this?" I'm like, "Yes." Or, "Hey, I had this great idea for doing this assignment. Like, if I did this together with this assignment, would it count off and get this work done too?" And I'm like, "Yes." So he just kept coming to me. And the gist of it was always, "I want to do more work. I want to work harder and I'll be done faster. Can I do this?" And I'm like, "Yes." So it was just a simple case about how just teach the principles of what you need to do. And then when you got smart people, just get out of their way and let them do good things. And Nino was fantastic with that. And
I want to jump in here and say
please,
that's exactly how it was for me last year when
really,
Nino reached out. It was
that's
identical. It was identical experience. Can I
so.
do this? Yes. I don't see why not. And that is exactly how it went.
Oh, it's so
He
funny.
pushed it to the limit and it's amazing.
I think I remember him saying, because like Nino and I were just like on a call, like just catching up a little while ago, maybe like, I don't know, 2 or 3 months ago or something like that. And I think he had said that his exact words to me were something about how with like wealth investment and passive income development, a lot of people, they can do it in like, I think he said like 9 to 10 years. And so Nina goes, "Check this out. I'm going to do this in 4," or something like that. So he just decided, okay, that's the standard. Boom. Here's me and my little hammer. Let's see if I can break through this faster. That is so funny that that was the same experience that you had with him.
Yeah, and
Oh
he
man.
absolutely like just killed it. Like
Ugh.
I don't think anyone that I've met so far, and I met quite a few people already from in our financial group. I
Yeah.
don't think anybody has beaten Nino's record. I think he's number one.
Hey your checks are coming in the mail. I appreciate the hype up, but Dustin, come on, get to it. I want to know more about how you got into public health.
So, okay. I'm just thinking if there's anything else that's worthy of sharing like that. I mean, yeah, okay. I could go back to this. I could spend more time. I had plenty of other fun stories, but they all just reflect upon something related to going out to Fontana or Whittier or something, like long drives where he could do rotation work, but just boom, getting it done. In any case, it was a good first cohort. It was encouraging. Learned a lot from that group, and then just as we rolled and managed that program, expanded it, improved a lot of its functions, made it a lot easier for interns, and uh, built it to more serve their needs and what they wanted to do. I enjoyed working as the coordinator of that program. I had a blast with it. I have a fondness, great love for education, and so this eventually, I think around this time, which would have been, let's see, that was 2012, 2013. So going forward from there, I think around like 2016 or 17, no, yeah, excuse me, 2017 or so, I started to think about just expanding education. So background and backdrop to this is not so much related to public health, but more of a personal note. Is the home that I was raised in, like the family that I was raised in, the faith that I was raised in, we have always treated education as a sacred pursuit, like a very special opportunity. And I don't just mean education from the sense of going to an institution and gaining a degree. I just mean like you've got this brain, it keeps building neurons, it keeps expanding its axial connections, and the world is full of great information. So get as much of it as you can. And so this combined with like the thought process on the world only pays you what it thinks you're worth. So get as much of an education on something as you can. I reflected on that again and again. And decided I wanted to go back and do a PhD. And in part, I noticed that at this time, as I was learning more about policy, health and food policy, most of the time as a dietitian who worked with people, I could look at a policy and I could think, why on earth would you do this? This doesn't make any sense. Like, maybe this sounds good on paper, but for real people trying to really bring this to pass, that really isn't going to do very much. That's not going to be very worthwhile. I think one instance that I thought of in particular was um, Mayor Bloomberg, who I don't know if any of you remember, but he used to be the mayor of New York City. He passed a policy that banned all soda cup sizes that were less than uh, that maximum limit of like 16 ounces or something like that. And I just remember thinking, like, number one, not a state official's job. Number two, you're going to get serious blowback on that. And that's exactly what happened. So I looked and I saw instances of that and thinking, like, who are these people and what are these policies they're coming up with, deciding that this is like the best course of action of what to do. So looking around, I looked at programs in local and SoCal and eventually came across public health, which I was not initially intending to apply for. Initially, I was going to apply for an organization management doctorate. And just, I think what happened, well, no, actually, what specifically happened is you had to take the GRE, which, if you've never had to take the GRE, it sucks. It's a standardized, worthless graduate test. And I did very well on it, but I was 2 points shy of the cutoff for the application of that organization and management, but I was just good enough for applying to the public health program. So I thought, all right, in for a penny, in for a pound, here we go. So I figured if that's what I'm qualified for, I'll go for it. And as I got into public health, I loved it. I thought it was super cool. I learned more about it, which is ironic because for most of the general public, like, how much knowledge do you think, or how much, not even knowledge, concern, care,
Mm-hmm.
how much do you think the general public gives a crap about the field of public health?
Yeah, it's very slim for sure.
Very minimal. And getting into it, it was especially cool because I actually had work experience as a dietitian, and there was very few dietitians in the field of public health. And so working in it and learning more about it, it just really gave me some alternative perspectives on how people approach health, a lot of perspectives on, political inclinations, because public health is super what's a good way to say this? You can't separate the world of public health from the world of politics, because at its heart, public health is policy. That's one of the major core functions, and policy is politics, just by a lesser known word, by a word that people don't associate with a lot of the nonsense and crap that we deal with and we put up with in modern political discussions. So it was cool to kind of see that, and then just to try to find my niche of, okay, well, where does food fit into this paradigm? How does, agricultural systems, which I've always loved studying, how does that fit within this frame? And so from that angle, once I was done with it, like, the research that I did, the work that I did, I worked with college students. I worked to improve diet quality of college students through small and simple measures. Those were the experiments that I conducted in my dissertation. That was kind of where all that led me, which I'm very happy that I did. And I mean, for the rest of my life, I'll just look at this and I'll just think, how awesome an opportunity was to get into it, because I mean, it was a totally different world than what I had been initially introduced to. And so that lands me to today at this point where I'm at. I'm currently the assistant director to the graduate program, the new one that we've started at Long Beach for students. I've gotten myself into a couple of other branches. I've worked in a couple of other areas, heavily in education. I've worked as a program reviewer. Literally yesterday, I just finished. I think I have to be careful about publicizing this. I just finished reviewing a program in a foreign nation for an accreditation agency, which was a really cool opportunity to do. Working on social media now, I do a lot of writing. I do a lot of scientific communication and writing, which I absolutely love doing. I'm not sure if I should say this or not, but currently, like, I enjoy my current job, but I'm open to alternative work and positions in other arenas for a couple of reasons, but I'll keep it short there. just because like those are not fully developed thoughts. Those are embryonic thoughts that I'll keep to myself for the moment. So yeah, there you go. That's
I
the
love it, man. I love
that's
it.
the role of it. That's the 10-minute explanation. There you go.
You've been all over, which because you're in such a unique space, and you mentioned you already touched into it about the amount of people that even think about public health, which is what I want. How would you, in your eyes, how do you define public health, and why do you think people should be interested in it?
Okay. Those are really good questions. Public health, I think there's no centralized definition of public health. And I remember specifically, like in our foundations class, when we had a foundations class, there was a big, long-winded definition to public health. I don't remember it at all. I just remember it was long and it was tedious. I'm like, I ain't writing that down. That's ridiculous. So public health has three core functions: assessment, policy development, and assurance. So those three core functions of what is the general state of the public in regards to certain health trends, how do you develop policy that improves those faculties, and then number three is how do you assure competent medical workforce and assure the services and the outcomes that you want to have within the population. My general definition, when people ask me about what is public health, I just tell them, and this sounds kind of macabre to say it this way. It sounds a little dark to say it this way, but it's just everything that kills people. It's the study of everything that makes your life shorter or longer, if you want to look at that way. Because in the foundations class, there was probably like 50 or 60 of us. It was a combination of a lot of MPH students and then the doctoral students. And no two people had the same thing that they studied. You had myself, the angle of diet and nutrition. I remember a friend of mine looked at mosquitoes and malaria transmission. Another person looked at suicide, specifically within minority youth. Everything is always super niche. There's another person who looked at cancer rates from cadmium deposits in commercial work sites and the connection between those two. I mean, it would, if you don't have a good center to yourself, public health can depress you because you've never thought to yourself, wow, there's a lot of things that are trying to kill you. There's a lot of things that make your life shorter. And that I think bumps people out. And because I said a lot of that function just kind of works itself into policy development, it also further just divests people from being interested in it because it is highly political. And I'm not saying highly political in the sense of like, BS or nonsense. I mean, like the affairs of the way we manage ourselves as a civilization. And just that just doesn't catch interest for a lot of people. But that is what public health is. And I think as to why people don't really pay that much attention to it is probably because of that, is because of the fact that it is highly political in nature. And number two is there's just so much to think about in terms of what makes your life longer or shorter that most people don't even think about. And people don't want to dwell on that. I don't think most people are very interested in dwelling upon things that kill you or things that make your life harder or something like that.
I almost feel like it's also because it's things that kill you slowly, right?
Yeah.
Not like FEMA where it's like, oh my God, hurricane coming, we're immediately in danger. But public health seems like, from the way that you describe it, it's just something that slowly, develops, and you don't really even realize that it's happening until it's already upon you.
No, it's
And
entirely
so, yeah.
it's entirely about risk. That's a really good way to say that. It's entirely just about risk. And I've learned in my work as a scientist in the field and how I communicate with things, whenever people will say something like, "You're the ones who tell us that if we eat this, it's going to give us cancer," and I'm like, "No, we don't." I say we say this contributes to the risk or this decreases the risk. Like that is by and large what everything is that you're kind of calculated out in public health is it's about risk, like things that increase the risk of this outcome or decrease the risk of this outcome happening. And whenever I communicate that with people, that's kind of how I try to like approach it. Is it's exactly like you said, Pei. It's like the slow fixation of it as opposed to like the instantaneous nature of it, which that oh okay, hold on. I'm having a thought coming to me now. COVID. I was a doctoral student during COVID, public health student during COVID, which also further solidified my very complicated feelings on public health and why we are terrible at it, because we effed up the trust of the public. because we mandated medical treatments. We demanded medical treatments in a field that, even though it is about policy development, it has broad overlap with medicine, and medicine is about the choice of the patient. And we punished people for making the, I'm using air quotes here, wrong choice. So it was wild to me how all of those ethics and those principles got thrown out the door the second that power showed up on the scene, power through policy developments, because all of a sudden everybody had all eyes on public health. And then we basically threw that stuff out the window, and we decided instead, okay, nope. And we know that this is typically, based upon options that you have for medicine, but no, this is a medical treatment that you have to take, no ifs, ands, or buts, or we'll punish you for it somehow. So we completely cratered our trust in the public as a result of that. I completely forgot where I was going afterwards with that point. Sorry, I'm going to have to stop there.
No, you're fine. And it makes sense. And I think that you mentioned how broad public health is. I can only imagine the difficulty when you're talking about the nutrition branch of public health. You mentioned right now that people might critique you and say, oh, you're the people that say red meat is going to be linked to cancer, or coffee's bad, or coffee's good. What I'm curious about from the nutrition side of public health is, you must be very frustrated, annoyed with the misinformation that goes on out there, specifically on the nutrition topics. And I know a lot of our listeners, people that I've worked with, always ask, well, how do I know what to eat if let's say my dietitian or my nutritionist or my health coach is telling me to promoting these certain foods, but then they go on social media, they go on the New York Times, they watch TV, and they're hearing the exact opposite, that those foods are actually bad for you from there. So how do you, from a public health perspective, in the nutrition side, how do you help to basically balance that out and kind of send a clear message when there's all these mixed messages going on, to make things easier for the public?
It's a good question. I kind of see it as, I think for myself, the way I approach this is, it's first an attitude adjustment, which I know that there's plenty of people who have made their name and they built their brand off of beating the misinformation drum. And when I say that, I mean like people who complain constantly, like misinformation is everywhere, bad information is everywhere. And they make a concerted effort to kind of gin up and foster a lot of anger and a lot of hostility towards people who promote it. And then equally at the same time, they like shine the light on themselves and say, but you can trust me, you can come to me. I don't like that approach, because I don't like making people angry. It's too easy. It's cheap. It's a cheap way to get people convinced of something, is to make them angry about something. And there's too many ways to do that. And so my approach is, I think about this epistemically. The difference between justified belief and knowledge, and crap information, misinformation, whatever you want to call it. All of us in our heads think of it as, basically there's a courtroom of determining what we come to believe is true, or what we come to verify as justified belief. All of us have a framework that we build in our minds where it acts like a courtroom. We hear the evidence, we take the evidence, and then based on the evidence that we see, we make a determination. We make a choice about how we're going to operate on something. So taking that in the instance and using a specific example in the field of nutrition, we could look at something like, what's a hot topic? What's a popular discussion or topic right now? Like just diet sodas. Let's take diet sodas. So my view of the literature, my read of the literature, my read of the health information is that if you take diet soda as a straight replacement for regular sugar sweetened beverages, it's a net good. It reduces your caloric intake, it reduces your added sugar intake. It helps you manage your weight in that respect, especially for people who are trying to lose or have already lost weight. I see it as a net good. And I will do that by putting out the information saying, here's what we know from the calories. Here's what we know for the mechanisms that explain that. Here's what we know about the side effects of diet soda consumption and what happens from that. And my angle is just always never about trying to convince people. I never craft an argument with the idea that the outcome in mind is, I have to convince you that I'm right. I like to show the information, and I like to show what happened in my head to help me arrive at that conclusion. And that leaves itself a little bit open-ended because I mean, I know this sounds kind of contradictory for me to say this in the same breath, but people may not arrive at the right conclusion. They may not arrive at the proper conclusion, but I mean, surely there is something that all of us could agree upon where it's just like, no, this is a stupid idea. Like, this is not something you can do. That's inevitably going to happen. But because I am in a position where I don't know that for certain, like that's a lot of another thing I've definitely gotten from my scientific training is that's certain things that I can't say this with a high level of certainty, but I think this is what it means. I think this is what the evidence shows. You just have to show people in a transparent way, here is how I arrived at this conclusion. Here is how I separated this between uh, here's how I separate this between general belief and justified belief, and why I think that's the way it is. And when I've done that, I found that that's been very helpful in terms of assisting people and teaching them about something. So, as a for instance, I could have an individual, and I could think about a case like in particular, like outpatient counseling. I had a person who was doing their diet history, and they told me, I don't want anything with GMOs in it. I don't want any genetically modified foods in my diet. And I went back to that and I said, can I ask you a question about the genetically modified foods? They said, yeah, go for it. And I asked, why did you decide to eliminate genetically modified foods from your diet? And they said, well, because, I don't remember what the reasons were they gave, but it was like, they're unhealthy for you. They're like deviations from nature. And I heard that if you eat them, it increases your risk of doing this and this. And so with that person, this example I'm thinking of, I said, do you mind if I share with you just like an alternative perspective about genetically modified foods? Because I don't see the need to completely restrict them from your diet. And I'd love to share with you why I think that is. And the person said, sure, go for it. And so for, about 5 or 10 minutes, I just focused on the education, explaining, well, here's what they are. Here's what a genetically modified food is. Here is how your digestive system and your physiology works. And when these interact with each other, here's what you can expect to happen and what goes about with it. And it was a very productive discussion. We went back and forth with each other and talked about it. And the person walked away thinking, okay, you know what? I'd be okay with some of those fruits. I'm not entirely comfortable with this, but I feel better about this. And to me, I was like, what's that phrase that I hear all the time on Instagram now? A win is a win. A win is a win, baby. I'm like, okay, a win is a win. I'm going to take it for that one. And I reflect on that conversation and I think to myself, how would that have gone if I had told the person, well, actually, GMOs are fine and you don't have to restrict them from your diet? From the perspective of the data, I am speaking accurately of what the data says, but the way I'm transmitting that and communicating that is not helpful because I'm telling a person they're wrong. And as both of you know, the second you tell a person they're wrong, barriers are going to get blown up. Barriers are going to get thrown up unless you're talking to a person who's like probably had life beat down on them a little bit more. But in any instance, I see that continuously in instances where you invite a person to hear how you think about it and you share that, and you find that when it's discussed that way, one of two things may happen. Number one is the person may integrate some of what you've explained to them or taught them, or they may think, well, thank you for sharing, but I'm not interested. But I guarantee you that the one thing they're not going to walk away from is feeling solidified in their beliefs or feeling like, I can't talk to this jerk. And that's too much of what public health was all about during that time period. Is we just we expected people to bend the knee and bow to, this is what you have to do, or people will die. Politicians' favorite phrase, people will die if something doesn't happen the way I want it to go. And as a dietitian, this is, oh man, long-winded answer for this, but going back to that, that's where I go with it, is just explain how you yourself landed between this, the epistemology of justified belief versus just general opinion or thoughts about something. And I think that you'll be a lot more successful if you approach it that way, as opposed to just mandating or saying, the science has spoken, the science says this, or something like that.
I think I like your example about the courtroom because it makes me, I'm thinking just as an individual, not as a practitioner, not as a clinician. If and when I hear information, and this is both financial information and health information, putting it in that kind of courtroom system where, okay, I heard today that red meat is bad. Okay, where did I hear it from? I heard it from this article. All right, I'm going to lock that in. Here's the argument for this side. Then I heard that no, actually red meat could be beneficial to support muscle growth. All right, I've heard that from this podcaster or this YouTuber. And then putting it in, basically hearing both sides of the argument as an individual, and then coming to your own conclusion. You don't need to justify it to yourself. But if and when you have a coach or a friend or a partner ask you about your belief, almost putting yourself back into that courtroom, that they are also having their own courtroom in their own mind. So then you're able to meet at a certain place where you're saying, okay, I believe this, but then you tell me like, well, hey, are you open to hearing kind of my view on it, or what I've learned about it from a quote unquote science perspective, right? And then, because especially if you're coming at it from a coaching perspective, there's a level of not the same playing field. You're the expert in this conversation, right? So then they take your knowledge with a little bit more of, okay, I trust this a little bit more than the influencer I see on social media. So I think it's not wrong to have your beliefs, not at all, but it's important to understand why you have those beliefs. And when it comes down to when you're trying to then go on this journey of improving your physical fitness or improving your finances, getting back to why you have those beliefs. And when you're seeking mentorship or coaches or help, understanding that the advice that they're giving you, hopefully, is for your own good, and at least be willing and able to listen to it. And I think I think the big problem that I've had in the past, and that I think people maybe have as well with public health, is the fact that people try to simplify everything, right? And you know this, Dustin, as dietitians, people will say, what's the best diet for me? Or can I eat red meat? Can I drink coffee? And my answer, as I've gotten further and further in my career, has been always, it depends. I need more information. Then when I gather that information, then I can start making an educated kind of guess or an idea. But from a public policy standpoint, the complete opposite is what is trying to be achieved. You're trying to create general recommendations for the general population, the general public, that might not pertain to everybody. Because on your artificial sweeteners example, I guarantee you, if you made a post about that, a public post on X or wherever you wanted to post it, you're going to get 90% of people who would agree with you, but you're going to get that fringe 10% who are going to say, oh, well, did you know aspartame causes cancer? Right. And so it's, from a public health standpoint, it's such a gray area. And that's why I think it's so, how do you address that? How do you address knowing from a public health perspective, it's geared towards the public, but yet on an individual level, we know that everyone's different. And in order to make the best recommendations, we need to know a little bit more about each individual person.
I mean, that's a great point and a great discussion on that. And I think especially the thing that you just said there about how none of us really ever need to justify why we believe something to ourselves. We just kind of do it and we don't actively think about it. That becomes a totally different ballgame when you're talking about a public. Individual is one thing, but public is another. And the crossover to it and the way that public health attempts to address that is most of them just think that every solution has to be a top down. That, okay, well, sure, you're a dietitian, you worked with this person, you improved their diet, they lost weight, that's good. But look at the millions of people who don't have access to you and they weren't able to successfully get that. And so their approach to that is you've got to tinker with the right dials. You got to tinker with the right dials, tinker with the right policy. And if you can address that, like you can address poverty, if you can address I don't know, any slew of the things that public health looks at. If you can take care of that at the top down level, then everything will just kind of fall into place the right way. That's how most people in public health would probably address that. The kernel of truth that relates to it is that there are definite factors and environmental forces that have an impact on our choices or how we live our life. The foods you have access to, and I mean, for both of you who have done very well with wealth and investment, I mean, for both of you, your resources, your material resources do give you ample opportunity to do a lot of really cool things. Whereas for another individual who doesn't have as much money or is more limited, they might be influenced by other factors that ultimately make the choices that they do. That's the kernel of truth to why that top-down approach is so easily justified. The problem that I observe and the difference of opinion that I have is you forget people. I've worked in clinics, I've worked with individuals, and what you see on those top down levels is not what those individuals ultimately are going to foresee. And we talk about that all the time in public health. We talk about it's a society, it's a civilization, but I mean, the fact of the matter is it's families, which I'm using instead of individuals. Like we say individual, like we talk about individualism all the time. We talk about individuals making up society. It's really not true. It's families, what we're talking about. And that shouldn't be lost on us either. And it's very easy for you to come up with some sort of policy, which in your head seems to make sense and might be a benefit, which it may. But when you actually try to address this on an individual level, there might be a lot of unintended consequences or blowback that you get from it, which is why, I mean, in my opinion, policy is good, but it's hard. And crafting a policy that is respectfully considering these two domains of what is going to do the most good or influence the most good for, improving the health of the public, but also what is going to respect and actually provide benefit when I look at this on a microscopic lens for individuals. And that's not an easy thing to do. And I think a lot of other problems is that too many people assume it is. Like, oh, is this a problem? Pass a law. Fixed. Oh, that's a problem? Money. Do this. And it's cheapening. The materialism is important. The money, the finances is important. It's cheap though when you're talking about people, because people are not as simplistic as we want to believe they are. Not as manipulable. Manipulable, is that a word? Manipulative? No. When you can be manipulated, whatever the participle is for that word, that really doesn't fly for everybody. But yeah.
So that's such an interesting point. And with all of that, both again from your perspectives as a dietitian and from a public health standpoint, the word health is very vague. I know, and I'm pitching this question because it's vague. So, having identified public health, having identified what nutrition is, and we've talked about nutrition in previous podcasts, what does overall health mean to you?
Health to me is a measure of the potential for your richness and substance to life. That is how I define health. That is what I think of health as from I guess both from a personal philosophy and from trying to fit the scientific data. It's the potential for richness and substance to life. Is if I am healthy, if I'm strong, I'm able to play with my family, play with my kids. I'm able to serve in my community. I have a friend who's like, hey, I need help lifting this into my truck. I can go do that. It's less time that I have to spend where I'm managing a chronic illness or dealing with a chronic illness, or, God forbid, if I get a chronic illness, because again, it's all about risk. You can never completely make it zero. If I was diagnosed with some sort of chronic illness, it's my ability to fight this so that I continue living. I continue trying to be a good neighbor, trying to be a good friend, trying to make meaningful contributions to my immediate community that I'm a part of. The more health I have, the more I have the potential for just this substance of living, of really making something good out of the life that I have. That's my answer to that question.
That's a beautiful answer. I mean, that's a really, really good answer. And with that, taking it a step further, because I know people are going to want to know, what are some practical tools or things, resources that people can use to live a healthy life per that definition? Because I will say that that's one of, if not the best definition of health that I've heard, because it encompasses both mental health, physical health, general well-being. All of that is geared with that same premise of what you just mentioned. So with that, what are some practical tools do you think people can use?
Okay, practical tools on the basis of it. There's a couple of things that I'll put to boot, and very specific things, and then go a little bit broader with it. Number one is move your body, move around. I mean, this is weird saying this as a dietitian, but exercise, move your body, go outside, walk around, go to a gym, go play sports, clap your hands, whatever you have the capacity to do. Human bodies are made to move, and the literature on health science, from exercise and what it does for you in terms of mental health, emotional health, and physical reducing your risk of what we call all-cause mortality. Move your body somehow. And the more you do, the better you feel. I don't have energy. You don't have energy because you're not doing it. I mean, majority of the time when people say like, I'm too tired to do something, you're not too tired to exercise. You lack the motivation, which is understandable. So find a way to do it. Number two would be eat more fruit and vegetables. I mean, for the American public specifically, I do strongly believe that there is what you would see as a spillover effect, that if you focused on something very specific in your diets, a small and simple change will have a trickle down, spillover. I'm mixing the words. It'll have a spillover effect to other things, where if you focus and you think consistently, every morning for breakfast, I'm going to eat an apple, or every morning for breakfast, I'm going to have a banana. If you can habitualize that, before long, you're going to start thinking, what else could I do to feel better about my health? And people will start to do it as a compounded effect. There is good science that backs up this habit forming process. And number three of what I would suggest for people is get into your community. We don't make it by ourselves. And I've really gone, I mean, my mindset on this has really shifted, where I have gone starting off from like, you know, the very, I don't want to say the commie perspective of collective, be a part of the group, be a part of the organism, then swinging all the way to the other end of like individual, radical individual. I'm like, don't tread on me kind of a thing, to now where I have come into this middle ground that I have found, and trying to understand both of those angles, and seeing that as an individual, I need to be a good member of my tribe, wherever that tribe is. Like if I'm on this podcast with Nino and Pei, I want to do something and contribute something well that's going to be good for the function of what we're trying to do. In my neighborhood, I haven't had a chance to talk to Jose in a while. I haven't talked to Frank. I haven't talked to Michelle in a while. Go over and check on your neighbors and how are they doing. You have a local concert in the area. Go do it. Just every one of us exists as a component of a community, big and small, in a lot of different areas. Be a good member of it. Give of yourself to other people in that respect, and you will find that there's a twofold effect. One is you'll find more of yourself to give to others, and two is you'll receive a lot more of that, because ultimately what you put into the world is almost as a surefire pin is what you're going to get back from it. So those are my three practical tips from the public health perspective. Move your body somehow, get the fruits and vegetables in, and then be an active member of your community in whatever respect you can find that as.
That's fantastic. That is actually so like on point, and exactly what, you know, a lot of people I think are needing to hear, you know, because
Okay.
our podcast kind of goes back and forth between health and wealth. And it's amazing how these two worlds that seemingly have no, like they go parallel, but they actually intersect, right?
Absolutely.
Because of this.
I
So
mean, this is what I know y'all do on your podcast and discussing this, but this is what I've heard Nino talk about a lot in our other conversations, that I just love hearing him describe, is like, okay, money, but why? Like, what's the point of it? And, you know, I see plenty of people, I listen to plenty of people where they have the money, but for them, the money is the end game. And they almost always cross me as like miserable human beings who I wouldn't want to know. And I love the question addressing of like, well, what are you going to do with the wealth? And, you know, all of us trying to search and find a way and a means by which we're doing that and what we do it for. And to me, that's, you know, the angle of like health is the same thing. It's like, why? Great, I want it, but why? And what am I going to do with it once I have it?
And also how to define it, right? Because I mean,
Yeah.
I've shared this on the podcast multiple times, that I think for me, going into both worlds separately, the goal was always superficial. It always started out with the superficial goal. It started for me in fitness. Well, I wanted to look a certain way. I wanted to have a certain physique, especially as a competitor in bodybuilding.
Mhm.
I wanted to look a certain way. Well, that quickly, not quickly, but over time, that morphed into, well, I actually enjoy playing soccer. Well, I do still enjoy training. Okay, well, I also want to live a long time. And I know that competing at 3-4% body fat every single year maybe is not the best approach for a healthy and longer life. Same thing with finances. I've shared this story that when I got into the financial world, I wanted to make money because that's what I thought I had to do. I thought the right thing to do was just make a lot of money and just spend it. And I thought that that would equate to happiness. But the more I got the money, the more I realized that's not the case. Yes, money allows me to access certain things that I wouldn't have been able to do without money. But now it's okay, well, what am I going to do with that money? And what's that money going to do to contribute to my longevity? So now we're talking about longevity from both factors. Well, then now we can merge the two. And I think from the health standpoint, going from a individual, you mentioned the community part. Pei is one of those people who, when I met her, like I mentioned, the way that I actually met her was she was hosting a community potluck for some of the investors that were in the Houston area. And it was like, hey, come together, like let's get together and let's talk about our finances, which is a very taboo topic for most people. And so I was joined the community. Then I went to go to meet with these people, and I realized, oh wow, there is this community of people that I can learn from. And I think the more you put yourself in those communities, be it financially or from a health and wealth a health standpoint, then you become entrenched in that and feel better. You're contributing to it, you're getting out of it, and then you as an individual are growing. And I think that that's so important and something that I think is very big. And I think it's so important to have people such as yourself. We've had other guests on who have very similar visions of what life means, right? It's not, we're not going to just bring people on and tell us, here's how you need to eat and here's how you need to make money. But it's all right, here's what I'm doing, here's how I approach it, but here's the grand picture of it all. So no, Dustin, I love your take. I love your just philosophy on life. Anything that you want to end with that you think is from a nutrition standpoint, from a public health standpoint, that you think people should know about just overall health?
I think I'll just repeat what I actually have on my Substack that's on my homepage, is where I just say, if you want to make great advances, here's the two things you have to respect. Number one, all change is voluntary. Number two, most people, they think in terms of health span. They don't just think in terms of lifespan. It's not just about thinking about, okay, if I do this, I'll live for 20 more years. Most people think, I think subconsciously, they think in terms of what I described as that richness and substance to life is opportunity for them to do more and enjoy more. You want a better life, wrap yourself on those, or you want better health, wrap yourself on those two thoughts and you'll go a lot further with them.
That's just, I love it. Because I love what your message was with the definition of health, because that could very well be the like the motto or the slogan for this show. Like truly, I love it. Pei, anything that you wanted to wrap up with before I kind of close it out here?
Yeah, I mean, two takeaways from, I mean, there's so many good golden nuggets today, but two things that popped into my head was what you just talked about, how like creating that meaningful goal, right? Attaching a meaning to your health goal, your wealth goal, that is going to really cement, all the actions that's
Yeah.
going to follow in order to achieve that. So that's, I think, such a key takeaway for me today after our conversation. And then the other one is just that judge panel in our mind
Mm,
blew me away, because I, I kind of never heard of it put together
Mm-hmm.
so well, and like that visual is so awesome, because now when I'm talking to people and trying to help them, right, I'm going
Partisan
to take a
session.
right. I'm going to take a step back and be like, you know what? Their panel of judges or core in their head is different than mine.
Yeah.
mm.
Right. So I just really appreciate the time that you are giving us and our audience on all these great insight and information. So appreciate that. Thank you very much, Dr. Moore.
I feel the same way. I love what you both are doing. I love the conversations you're having, and I really appreciate the chance to come on and just kind of share those perspectives with you.
Yeah, of course. No, Dustin, I think you've given our listeners just an opportunity to learn. I don't think many people would have or really spend much time thinking about public health aside from when they complain about certain policies that they don't like. That's probably the
Yeah.
extent of to what they think about public health. But
Yeah.
there is public health does impact us both on a large level, on a community level, and then also on an individual level. And I think the more that we as people who are wanting to help out, but also people as individuals, the more that you can understand of what's truly going on, the better you can make sophisticated and educated decisions to improve your life. So I'm hoping that people gather that from this discussion. Also got to see a little bit more about me on a personal level that I wasn't expecting to.
We should have another episode where we just talk about our stories of Nino. Hey,
Oh,
Yeah,
my
we should just
good.
roast him. Let's just
just
roast
roast him.
him.
The
Oh,
roast
so
of
easy.
Nino
The roast of
Gonzalez.
Nino.
So much material. So much good material.
Oh yes, stay tuned. That maybe episode 100. I'll bring on all. I know who I already have the people in my mind who I would bring on to roast me because there's plenty of people there.
Gosh.
But yeah, I mean, there was just a wide ranging topics, and this is what Dustin and I talk about multiple times, just on a personal level. And although we're not close by, we're able to connect, and I consider Dustin to be a good and valuable part of my own community, even though he's not, fully here with me all the time. And I think it's so important to have those conversations and those types of people in your life. So again,
Yeah.
Dr.
Mutual,
Dustin Moore, thank you again for.
Yeah, it's Dustin to you, Mr. Easy there.
Everybody, thank you so much for tuning in. We hope you learned a lot today, and we look forward to having you on the next episode. Take care.